Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and LeNae.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
What's up, Tripp?
Hey, LeNae.
What you doing?
I'm just doing the do with you.
Doing the do with me. Hey, did I tell you about the time that I skipped school and some friends and I decided to go bungee jumping? Did I tell you about that?
No.
Yeah,
What?
we got suspended.
Okay.
Joke. Okay, I have skipped school, but I've never gone bungee jumping. And I don't think I would do bungee jumping on a day I skipped school because that's just dangerous. Anyway, speaking of school, our little 8th grader, our youngest, Huck, had his 8th grade graduation ceremony. And they did a slideshow and they showed pictures of all the kids in the class. They showed baby pictures and then they showed like, this is then and this is now. And they were playing like this music and I'm like, oh my God. And I started like crying. I'm like trying to hide it because I think I'm the only loser in there that's crying over all these pictures and my little baby growing up. And I'm probably going to be a freaking mess when he graduates high school. So I didn't think we were going to, like 8th grade, man, was hot. The first semester was hard, like getting him focused on like the point of school and why he's there. But he really turned it around in the second semester. And so I'm excited to see what he's able to do in the 9th grade.
Yeah. I think it's going to be good.
Yeah, you're going to have to project because I forgot the cord that connects the box to the microphones, Tripp.
Oh, dear.
So you don't have a microphone, so you have to project because you're going to tell everybody, what are we talking about today?
Oh, I thought we'd maybe address some of the benefits of regenerative therapies and end organ damage and maybe diabetes or that.
Okay, so looks like you got a case study there.
Oh, yeah. It's a case study from a little while back, but really showed some real benefit in this patient. It's diabetic with multiple problems. And
Male, female?
Male.
How old?
About mid-70s. He's had his diabetes. It was treated with multiple oral medication, insulin, and had. He was a smoker when he started. Also has some COPD, some congestive heart failure related to some coronary artery disease and peripheral vascular disease challenges. And
Sounds like a hot mess.
Oh, he was a mess. Yeah, he had multiple issues. And after our preliminary evaluation, I talked to him at length about. We did the optimization program, and he started getting better with that. And his kidney function was kind of just very close to necessitating dialysis. And he really didn't want to be on dialysis and all of the other problems related to his diabetes and neuropathy and those things. And so his diabetes was getting under much better control. He had quit smoking, was doing better from that perspective. And the total level of inflammation in his body had significantly declined, which was really very gratifying because he had some fairly severe degenerative arthritis and that type of thing. So he was feeling much better already, but his kidney function really hadn't improved. And since it was kind of borderline, we had been talking about, and we're talking about doing some systemic exosome therapies using umbilical cord originated stem cell related.
Did you say
exosomes.
umbilical?
Oh, right. Umbilical cord.
Umbilical. Okay, well, you're gonna have to let the listener know what that is, because that people still don't know what that means, and I think there's a lot of misinformation about umbilical cord, exosome, stem cells,
Oh,
whatever.
umbilical cord, as everybody probably knows, is loaded with stem cells and things that have help the fetus grow to maturity and be capable of being born. So at the time of birth, in healthy childbirth with the consent of the mother, the umbilical cord and the placenta can be taken, and the stem cell products can be derived from the placenta and the umbilical cord. And
So they are donated by consent of the mother
correct,
after a healthy birth.
healthy life.
Okay.
Yeah.
Okay, continue on.
So they get prepped and go through a bunch of screening processes, and they obtain either the stem cells or and then these can be processed to get the particles from inside those stem cells, which are really the mediators of everything that goes on. The stem cells really just are the kind of the factory that produces the messengers that go out and help the other cells do their job properly and establish an environment, help establish a healthy environment for them to do their job. So it's really the exosomes, those extra cellular vesicles that actually have the ability to create the outcomes and the benefit that we see when we administer them. So I had been talking to him for a couple of few months. I also wanted to make sure that he was going to be able to discontinue his smoking habit and be on a path to improved health, which he already was. He was already feeling much better after he quit smoking. And the nutritional and physical optimization process had already garnered significant improvement in his diabetes. I think his hemoglobin A1C, which is a kind of an average blood sugar measurement, was at 11 and a half or so when he started. And by the time started talking about the systemic exosome administration, his A1C was already down in the mid to low sixes, and he subsequently actually got down into the fives for a little while, but he still had to use a little bit of insulin. He didn't have to use any of the pharmaceuticals anymore, but he was using in lieu of 50 to 60 units of insulin a day. He was down to maybe 5 or 10 units to maintain a good average blood sugar level. So he had done really well from that perspective and was really doing quite well overall, feeling good, but his kidney function was still causing him to swell up in his extremities, and he was still having to take a fair amount of diuretic, Lasix, and that water pills to keep the fluid down, and it was not pleasant. So as we talked about using the systemic exosomes, he said he wanted to try that, and at the time, the research was already pretty good and certainly in the experimental animal data had already been showing multiple pathways that were helped by the administration of the exosomes. So he opted to try, and although there was no guarantee that he would get any improvement, we went ahead and did a sequence of exosome infusions and the results in retrospect were actually pretty remarkable. I think his insofar as concerns his kidney function, he got about a 40 or 50% improvement in his kidney function, which allowed his kidneys to function better and helped him get the fluids off. It helped him live more comfortably from that perspective, although it wasn't perfect, and it was a significant improvement, and he really appreciated that. But not only that, but it actually helped his diabetes also, which is some of the basic science data that has been garnered on the effect of healthy exosomes being administered to unhealthy diabetics. We really see again a decrease in that insulin resistance, particularly in the type 2 diabetics, and an enhancement of the health of the beta islet cells in the pancreas, which produce the insulin for us. So it's really kind of interesting to see all the positive little effects that that healthy exosomes can share with the with an unhealthy individual. But you know, on the other side of that coin, the exosomes that are produced in an unhealthy environment, say in a diabetic, they actually propagate the disease. So, in the presence of high blood sugars, multiple immune and metabolic functions are compromised simply by the messaging that's carried around the body by these little particles that carry all these chemical and biological mediators, which, you know, over the course of time is just it makes somebody that has those problems worse and worse and worse. So they're the little communicators, so to speak, that propagate disease in an unhealthy person. But when administered, when healthy ones are administered, they shut down a lot of the inflammation and shut down a lot of the abnormal pathways that we see develop in diabetics.
Wow. So, what would have been the ideal scenario there? He had, I mean, he was pretty, I don't want to say like messed up, but he had a lot of issues going on. And so, would you say that the approach was more reactive than proactive? Could he have been more preventative and proactive? Would that have made the treatment more effective if he was healthier on the onset?
Well, I mean, I think his lifestyle and that all of you know his previous activities over the course of his life led to that outcome. And obviously, had he lived a different life with less and had a different genome, or his actual lifestyle acted on his genome, on his the genetics he was given by his mother or father, and that ended up causing the disease process. But had he not lived in that way that was probably actually communicated to him by his parents and his environment when he was younger, he probably would have been able to avoid that for sure. But his behavior, at least in the first year and a half after he came, was almost exemplary, although it did take some chiding.
Tasing.
And yeah, and but he finally, he was really fairly compliant. I think he had some difficulties because his wife was not inclined to help him with his nutritional lifestyle.
She was enabling his demise.
I think so.
Mm.
She wasn't real keen on him using his money for the exit
She didn't want
for
him
the biological treatments. So
She didn't want him to invest in his health. Look, guys, if you're married to somebody who doesn't want you to invest in your health, I mean, you might want to consider your options there.
Clearly, I think, but I think that's eventually why he was lost to follow. But at the time he left, his kidney function was significantly improved. His diabetes was trivial at the time, and he was no longer a smoker, and his COPD had improved. His overall sense of well-being was significantly better, and his energy level was he had gone from and not doing anything and kind of sitting around and watching TV all the time to he was a kind of a classic car fanatic, and he had gone back to building an antique car that he had been working on for
Nice.
a couple of years. So he is I didn't notice any significant improvement in the neuropathy from the diabetes, but his clearly his mood was significantly improved. He was a happier individual and much more energetic. So I think the benefits he got out of that, and particularly the improvement in his kidney function, was key to part of that, because he wasn't having to deal with the side effects of the borderline end stage renal disease. So
Good Lord. So, just for clarification, insurance does not cover exosome therapy. Generally, pricing can start at, well, for an infusion, it can start at what? Like 6,000
well,
for an
it
infusion?
depends, yeah, it depends on how many are being considered, how many billions of exosomes are being considered. But That kind of depends on the size of the individual and has to be calculated. But yeah, $5,000 to $10,000 is probably going to be a reasonable guesstimate for intravenous therapy.
Yeah, but the quality of life that patient received, I'm sure, even if his wife didn't want him to live longer, I'm sure he thought it was a good investment. Anyhow,
no one knows what goes on there.
yeah, right. All right. Well, we got to wrap it up because we've got something else we've got to do in about 4 minutes. But anyway, listener, I hope you found this informational, educational, somewhat entertaining. And until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm LeNae. Until next time, feel it, look it, and live it.